everyone, my name is Elizabeth, known as the Shrinking Snake Lady, and I'm here to give you a post-op surgery update. If you didn't already hear, I had surgery with Dr. Magnon on November 8th in the Dominican Republic, and I had tummy tuck, muscle repair, and lipo and Brazil butt lift. And what that is that fat transferred to your butt, and you could also have it transferred to your hips and lats if you want to. You could have it as dramatic or as natural as you want it, and over there. So, and definitely it's your choice. I definitely had a great experience over there. It was pain-free, and that was such a relief for me not having I have no pain tolerance at all, and this being my first surgery ever. And I'm so grateful that I went there, and I don't regret going to Dr. Magnon at all. So just to keep in mind, even though you put on the customs that you are only going there for leisure, that you're not going there for surgery, if you have your drain in like I did, and I was hoping that I didn't have to come home with a drain, I had to come home with a drain, and I was 13 days post-op, and you need a medical release form letter from your surgeon saying that it's okay for you to fly back home, and you got to show that to someone over there at the airport. And I also did wheelchair service, and it was easy. Like, I showed them the form, they saw the form and got that, and it was all taken care of. And then they wheeled me to my gates, and everything was fine. I was treated with respect. I did, however, had to get checked at security in a room because one thing is that you can't wear padding underneath your compression garment, which is your faja, and for security reasons. And if you do, you're expected to take off the faja, which is hard to put back on. I was freaking out. They took me into a room. The lady, I was trying to communicate with me, and I was trying to communicate with her, but my stupid Google Translator app was not working at that time for some reason, and I was freaking out. And I took off my dress, and luckily she saw that I just had 2 poise pads over the incision, and that's what they put on me. But I didn't have any lipofoams or anything like that. All I had was just the 2 poise pads over it. And she saw that, and luckily she said it was okay, and I just needed to sign that form to say that I was treated well and respected, and I did. And they wheeled me. I didn't really know what was going on. I just gave them this form or that form, and I had to fill out a form as I was being wheeled to the gates, you know, as far as my stay, and I got on the flight. Everything was fine. Actually, no, correct that. I swelled like crazy, and I should have kept my stage 1 faja. Stage 1 is where the faja that they put you in right after surgery, it doesn't have that much compression, and so I should have kept that because I swelled like crazy. That was swell hell for me, and I am grateful that I had that experience to realize that the swelling afterwards, you know, afterwards here, isn't as bad. It's not bad at all. You just look a little bit heavier. It doesn't hurt. It's no big deal. Okay, so I was just trying to get up as much as possible on the flight. I was massaging, and I had a great experience with the flight attendants there. They were really, you know, nice. They complimented me. They got to know like where I came from, what I did, and it was nice because I was swollen like crazy. I looked like a can of busted biscuits or whatever, and I was just not feeling the best because you're just swollen, and it got to the point where it cut the inside of my inner thighs. That's how swollen it was, and I tried to get up as much as possible, and then I did have a layover. I can't remember where, but I did have a layover for a few hours, and then I came home and I was super excited to see my husband, because I was in the DR for 15 days, and so I was happy to see him. He was willing to help me out. He was sweet, and he was just stressed out because he didn't know how to put the freaking paw on me at first, and it took a while, but we got the hang of it. And plus I was bent over, and not because it was painful at all, it just, I was told that not to stand up for 2 to 3 weeks because you don't want to stretch out the incision. And so I just wanted to make sure that I waited till the 3-week mark. And it was nice also to take a shower, well, like a sponge shower here in the States, because over there in the Dominican Republic, the water isn't as clean as the States. So to clean some parts of you, you would have to clean with the bottled water, or like I would wash my hair with like you know, over the sink, and that would be fine, just not anywhere that was anywhere close to the incisions. And I would also clean with like bottled water, like some parts down there, and with wash there. So other than that, they use baby wipes to clean you, and that's how you get cleaned over there in the Dominican Republic. And also I was trying to take a bird bath here without trying to get the incisions wet at all, and that was a struggle because I was trying to keep the drain out of the way, and it was so annoying to have that drain. I was sick of it. And then on my 3rd week, 3 weeks post-op, luckily I found a surgeon to remove the drain. Initially I was going to do it on my own. I found YouTube videos of how to remove it. Most people remove it themselves, and it's just a simple clip pull kind of thing, and it looks simple enough, but I just freaked out. And I found a local plastic surgeon, and he was going to help me out and to remove the drain. And normally a surgeon won't touch another person's work at all, and there's been cases that people would have to get it removed in the ER in some cases. And luckily I found a surgeon to do a post-op check and to check to see everything was good and remove the drain. And I was so elated when they removed the drain. And did it hurt? No, not at all. It felt like a snake going around your waist, and then I just saw it getting pulled out, and it was super cool. And I was super elated when it was gone, and I stood up right at 3 weeks at the visit, and they said I could take a full-on shower like a day or two after that, and it felt so liberating not having to bend over and try to keep everything clean and not wet. So it just felt great to take a full-on shower, and I was just happy. So when I came home, I slept on the recliner, and I slept on the recliner for about 4 to 6 weeks. And then around that time, that's when I started to slowly try to sleep on the bed on my stomach. And at first it was uncomfortable, and then it got better, and now it's back to feeling comfortable like normal, like before surgery. So as far as post-op care, the biggest thing that is highly recommended from my surgeon and other surgeons is to wear fajas, which is compression, and also to get lymphatic drainage massage. And that's a big thing that you want to take advantage and be 100% on that initially. Fajas you want to wear 23/7. I've heard around 4 months or so, and then after that you can start breaking it to lesser times of wearing it. Everyone is different. Everyone you know, heals differently. Their swelling is differently. So you want to just listen to your body on that. But I do notice the more people wear them, the better the results that I've seen on people. Out of the country, in the States, I've seen better results from people. And I definitely noticed in my body the difference, because I did not wear my faja for like 2 weeks or so, and I did swell up, not like a whole bunch, but I did swell, and I did notice a difference. And I did notice a difference as far as my back. If I don't wear compression, I would get like some back pain, a little back pain from the back lipo, but as long as I'm in compression, then my back doesn't hurt. So that's what I've noticed with myself. And so everyone is different. The surgeon here that took out my drain, they don't even recommend fajas. They, you know, give them a binder for a couple, you know, for a little bit, and then like if someone wants to wear something after 3 weeks, they could wear like a Spanx, they said, but they don't recommend any compression after that. So everyone is different, so just keep in mind you want to listen to your body, and it doesn't hurt to wear it even if your surgeon tells you you don't have to. I wear a corset now. I haven't been wearing a faja. Now keep in mind it has a bad stigma as far as corsets, and that it'll damage your organs and all this kind of stuff. But here's the rule with anything: if you cannot breathe or you are in pain, take the darn thing off and switch or loosen it up or switch to something else. Listen to your body. That's common sense. Anything that is too tight, whether it be a faja, a waist trainer, a corset, an outfit, jeans, anything that is too tight can hurt you. Yes, and if you're not listening to your body, and you keep wearing it, yes, it can get extreme and it can get that way. So you gotta listen to your body, and the main reason why I'm doing this is only just for compression and to help with the swelling. And I like how the corset doesn't bend at the waist, and so I definitely love that over a faja. And I will be doing a faja review shortly. I want to review on which faja, what I like about them, and so that way I could share with you on that. But for the most part, I only wear this probably around 10 to 12 hours a day, and it varies. It could be more, it could be less, depending on the time frame. But I wear it mostly to work and then at home. But if I'm working at my second job at Domino's, a lot of getting up and down, I don't wear it because it's a lot of like a struggle to like get up and out of the car constantly. So that's why I don't wear that, and I don't wear it to sleep. I do wear like a wraparound thing to sleep, or sometimes I don't sleep without, I don't sleep with anything. So it just depends. And if I swell up more or if I'm in pain, I'll get back into the compression. So I'm just kind of filling it out and trying it out. And as far as post-op lymphatic massages, I got 2 daily wows in the DR, and here I got 2 a week since I've been home. And then probably a couple months ago, a month or 2 ago, I switched it to 1 a week, and I have probably 2 more weeks left of just once a week, and then I'll be done with my professional lymphatic massages. But I'm still doing my own lymphatic massages that my masseuse recommended, and that's definitely been helpful as well. And I do have this wall massager as well. I got it for like 20 bucks at Walmart.com, and it's a heated massager. They have different ones. They have a heated and a cool one, and this one heats up and has different attachments as well. And I use coconut oil. You could use arnica cream as well. Okay, working out. I noticed a lot of people have different time frames as far as when to work out post-op. General, the rule of thumb is 6 weeks before you can work out, but everyone has a different definition. Initially, you want to start walking as much as possible right away out of surgery, depending on what your surgery is, how you're feeling, and what your surgeon says. The reason why you want to start walking is to get that blood flow going. Now, I'm not saying to go on incline on the treadmill, to go to the gym and go hit. No, that's just walking. You're going to be bent over walking to get some blood flow going. You, as far as cardio, you kind of want to wait till like 4 weeks post-op to do some light cardio and kind of like feel your body and see how your body reacts. Not like HIIT workout, but just some light cardio, and to see how your body feels. 6 weeks, I did weightlifting, and you kind of want to hold off on just test things out as far as your abs, because due to the muscle repair, your abs are going to be kind of sore, and you don't want to put too much strain on it too soon. And so you want to work those ab muscles as much as possible, and you could just do it just even by flexing your ab muscles in the meantime, and just to get it like going and see how it feels. And then you could start doing the crunches or different ab workouts, and then also do like weighted ab workouts. And so just test your body. Everybody's different, so don't freak out if you are healing at a slower pace than someone else. Everyone's going to heal differently. Everyone's going to react to things differently. So just go at your own pace. Alright, that's pretty much it. I feel pretty normal like I did prior to surgery. So if you have any questions, additional questions, please list them below, and I'll try to share in future videos. And when you're choosing a surgeon, just go with what your interest and what you really want to. And everyone has different likes and different foundations, and be prepared that you may need more than one round to get your ideal body. So it's either to have different expectations or have multiple rounds to get to a certain expectation that you want. I want to just at least have one more round just to get a breast lift, implants, a lipo, BBL, and thigh lift. And it's going to be with a different surgeon, but in the Dominican Republic. I definitely love going back there, and there's nothing wrong with Dr. Mignon. I totally thought like something was bad with an initial surgeon when somebody was a hybrid, but no, it's totally not that. Just everyone has their different specialty. I am not one to like push a certain surgeon on anyone, because everybody has different likes and everybody has different foundations, and so go with whoever you want to go with. I'm not one to push anything on anyone or make anyone feel bad for going to the States or to another country or another surgeon. I've seen a lot of pridefulness and hostility between one surgeon to another, and I'm not about that life. I mean, I really don't care who you go to. And so just choose the surgeon that you want to go to and go. And just try to save a little bit each time, and definitely make it happen. And I believe in you. If you want this surgery journey and you're thinking about it and you're in the beginning stages, I know what it's like. I spend like hours and hours and hours and hours researching real life transformations on Facebook Lives, like people seeing people's transformations there, their YouTube videos. I invested a lot of time on Real Self, and it just seeing their actual transformations, not just the before and afters on the surgeon's pages, but I'm talking about like real life, you know, transformations before and after videos, and seeing the transformations, and I see the good, bad, and ugly, the complications that can happen. So that's why you want to have extra than what you're quoted. And so, because it's better to have extra and come back home with extra than not enough if anything does happen. So I highly recommend to save more than what you're quoted and what you tallied up, just in case, like, you, one, have complications, two, you want to spend extra money on getting a facial, getting a mani and pedicure, you know, doing extra stuff. So you want to have that luxury to have that that available, and plus it's good to have extra money regardless, even if you don't have surgery. So if you're getting in your weight loss journey, start saving now, because it does take time to lose weight. And if you don't end up getting a surgery, then you have extra money in your pocket. But surgery isn't, plastic surgery isn't a must need that you have to have. You could learn to love your body along the way, and don't feel disgusted with yourself even after you get your first round, because you're still going to have those imperfections. And so you got to learn how to change your mindset and love those imperfections as you're making changes, whether you are losing weight, you're gaining muscle, you're getting surgery. You know, you gotta learn to love yourself, because you're still gonna have those things. You know, you're still gonna have scars, you're still gonna have stretch marks, you're still gonna have extra skin on other parts of your body, and you're not gonna be 100% perfect. So just remember, choose to see the perfection in yourself and to love yourself as you are making these changes. And just because you get surgery doesn't mean you hate yourself as well. So thank you so much for watching, and I hope you have a wonderful day.